Good evening, namaste to everyone. A warm welcome to the today's class. Again, a very beautiful class, very important class of BHB. So let us do the prayer and then we'll start the class. Yes, good evening. Just close your eyes. Take a deep breath in and exhale. Another deep breath in and exhale. One more deep breath in and exhale. Remembering our parents, our gurus, receiving their energy. We'll start today's class. Okay, so today's topic is very important. Today's topic is pain, the next chapter. After edema, the next chapter is pain. Why pain is an important chapter? Uh, Without wasting time, if I ask you one simple question, what is the major problem? What is the most common problem with which a patient comes to you for treatment? You can relate to that, right? It is nothing but pain, whether it is cervical pain, whether it is lumbar pain, whether it is sciatica pain, whether it is knee pain, abdominal pain, or any type of problem, you will see 80% of the problems you can relate to are related to pain. That is why understanding what pain is, what is the cause of pain, what causes pain in the body, and how this pain can be diagnosed, and how can we use it as a tool of diagnosis to understand what to treat, where to treat, when to treat, and how to treat. This is the name of the book. Na? Parikshan is all about what, when, how, where is Parikshan all about. So we are really thankful to Professor G.C. Agarwal sir, Dr. G.C. Agarwal sir, for this wonderful, beautiful knowledge which he has given, compiled in a very beautiful way in the chapter of pain. Okay. So if we understand pain as a chapter, as a subject, as a heading, what we want to learn today, pain is a pleasant feeling or unpleasant feeling? Everyone will agree it is unpleasant feeling. Okay. So this pain, which is unpleasant feeling, is it important for us or it is not important and still we feel it? It is important, right? It is very important. Why this is important? Like we studied about fever. Fever is important and fever is not important. Fever is very much important because it is a symptom which guides us that there may be something unusual going on in the body. So be aware and treat that ailment. Correct? Similarly, pain is an unpleasant feeling which guides us that be aware something is harming you. For example, if a pin hurts you, you immediately move your hand, right? That is reflex action. But why you move your hand? Because that pain is guiding you that there is something which is hurting you. Correct? Similarly, this pain, whatever the cause may be, it can be because of burn, it can be because of cut, it can be because of any other injury, any accident, any trauma, any emotional feeling, whatever it is just guiding you that stay away, it is hurting you. Correct? Be aware. So this is a very important symptom, which is it is a very important part of our, you may say, a body, our energy system, which is helping us to survive in nature. Okay, without which we cannot survive. If there is no pain, so if someone is harming you or it is injuring your body part, you will not be able to protect yourself if you don't feel the pain, isn't it? uh, so an important question rises up is, how do you feel this pain? what this pain is. There's an article written by me in one of the Saraswati, I think 2008 or 2009. Pain, the gateway model, the gate theory. You can go through that. Though we are not going into that detail of the topic, but it is very important to understand how do we feel pain and how acupressure treats pain. See, what we are doing is, this is really interesting if you try to understand. When we are giving acupressure, somewhere or the other, it is related to pain. You are creating a sense of pain, right? Nowadays, it is much advanced and we are not giving pain to the patient, but in general, acupressure is synonymous to pain. That acupressure therapists, they create pain in an area. Okay, now we have that understanding that let us not give so much of pain to the patient that the original pain becomes less in comparison to the pain which we are giving, right? So that we are actually somewhere related to this pain world, because we are doing something for which that pain is created, and this pain is treating or healing the other type of pain which is there in the body. So this pain which we are creating is temporary for a short duration of time, and it is in much lesser intensity in comparison to the other pain with which a patient comes to us. Okay, so pain is very important for us to understand what is that and how this body gives a sensation of pain in the body. So there are different type of sense receptors present in the body which are giving us a sense of pain. For example, there is receptor for heat sensation, there is receptor for touch sensation, there is a receptor for pressure sensation. So these are different type of, maybe many more are there, which we are able to sense. But you will see whether it is heat or pain or pressure, ultimately everything is leading to pain only. If there is too much of heat sensation in the body, what will it lead to? It will lead to pain. If there is too much of pressure, if you're giving too much of pressure on a certain point, it will give pain sensation to the person. Correct? So whatever sensation, if it is in excess amount, it will ultimately lead to pain in the body. So what is present in the body which is giving us this pain sensation? These are nothing but the nerve endings. So the nerve endings are the receptors for pain sensation. So how nerve endings are responsible for pain? Nerve endings are responsible for sensation to understand. Like if you're touching something, if I'm, for example, I have this box with me. So if I'm touching it, okay, why my touch is giving me the sensation of touch? Why is this giving me the sensation of touch? Because there are so many nerve endings present here. These nerve endings are taking the stimulus or the sensation of touching the object, and this sensation from the nerve endings is going through the nerve, coming to the spine. From the spine, the track is taking the sensation to the brain. In the brain, there must be some area which is analyzing, okay, this is touch sensation, so you are touching it. So that reflex is coming back through another nerve from the spine. It is coming back to the fingertips again and giving us and making us understand this is touch. Similarly, there must be something afferent and different. Yes, we are not going into that because this is what is happening. Something is going into the brain and coming back to the receptor organ and giving us the feeling that we are touching something. Similarly, when we talk about pain, there must be some nerve endings. So there must be some nerve endings on the area which is getting the sensation of pain. It is taking the stimulus to the spine. From spine, it is going to the brain. From brain, it is coming back to the spine. And from spine, again, it is coming back to the fingertips or whichever area is sensing the pain and giving the sensation of pain. Is this okay? This was the whole chapter in the most simplified way. Okay, so if I explain it to you like this, that this is an area which is sensing the pain. Okay, and these are the free nerve endings. From the free nerve endings, actually, the arrow should be on the other side so that you don't get confused what I'm drawing. So sensation is getting into the free nerve ending, and from the free nerve ending, it is traveling through the, as you said, efferent nerve to the spine. This is cross section of spine to the spinal area. It is something like this. And through the spine area, it is going to the brain. Okay, and from the brain, the sensation is coming back to the area and giving us the sensation of pain, that okay, this is pain. So here, this pain was stimulus. And here, after when it is coming back, it is giving us the intensity and location. Two things we are understanding: how much is that stimulus and where is that pain. Okay, so if you are getting hurt in the whole of the palm, or you are getting hurt only on part of the finger, who is giving you the sensation that the pin has been you got hurt on this, only this particular part of the finger or whole of the palm? This is analyzed by brain itself. Okay, and two parts of brain are important for that. One is thalamus and one is cerebral cortex. What did I say? There are two parts which are involved in this. One is thalamus and one is cerebral cortex. So if I show you one picture, which is a very beautiful picture, you can keep it for future reference also. See, this image may look little complicated to you, but it is very important. Once I explain, you will understand the whole of it. What is this is? Give me a moment, please. So this is the area where the pain is felt. And what is the receptor called, which is sensing the pain? It is called nociceptor. Remember this. This is important. The receptors which give us a sensation of pain are called nociceptors. So there are different type of receptors which are present on different part of the body. Some receptors, these receptors, specifically if I talk about nociceptors, these nociceptors are the pain receptors which are present on skin, which are present on muscles, which are present on tissues, which are present in joints, which are also present deep inside the body, but maybe scattered. Okay. So if I talk about these nociceptors through efferent nerve. Efferent means the nerve which will take the impulse to the spine. Okay, so it is taking, efferent nerve is taking the impulse to the spine. This is spine. This part is spine. It is a cross section. If I cut the spine like this is how it will look like. So after taking to the spine, specifically to the dorsal horn, why I'm giving you all these detailed words, because this will help you in learning something new for future. Okay, through the dorsal horn, there are two types of horn. One is called dorsal horn and one is called the ventral horn. Okay, so from the dorsal or the posterior horn, this impulse is going into the spine and then moving up through the spine through a path which is called spinothalamic tract. And through this track, it is going to thalamus. So this is nothing but the thalamus. After going to the thalamus, it goes to the cortex, cerebral cortex. So see there how pain is going to the brain. First, from the nociceptor, it is going to the spine. Number one, first it goes to spine. Number two, from spine goes to thalamus. See, I'm simplifying it. There is a lot of detail under it, but I'm just simplifying, making it very, very simple for you to understand. First, the impulse is going from nociceptor to spine. Number two, from spine, it is going to thalamus. Thalamus is a part of the brain. And number three, from thalamus, it goes to cerebral cortex. And cerebral cortex has the area to sense pain. And from cerebral cortex, the impulse comes back to the area and says, okay, this is the area which is getting hurt, or this is the intensity. There are two things. One is the area, which area is getting the pain sensation, and how much pain is there. So these two things are analyzed by thalamus and cerebral cortex. So this is how we feel the sensation of pain. Is this okay with everyone? I think it was very much simplified for you to understand how we feel pain. So I'll show you some receptors which are present on the skin. This is also very interesting. See, these are different type of receptors which are taking the sensation of different type of sensations. So one is free nerve ending. This is free nerve ending, encapsulated nerve ending, sensory cell, peripheral processes. So all these are nerve endings only. So nerve endings are taking from this is a superficial area. It is going deep into the nervous system, to the central nervous system, and then central nervous system analyzes what type of sensation is that, whether it is heat, whether it is pressure, whether it is touch, whether it is pain, whatever it is. Okay, so this is another thing. Now, there may be different type of stimuli for pain. Stimuli for pain means there may be different type of causal agents for pain. What are the different type of causal agents for pain? For example, one most common example of stimuli for pain. It may be mechanical. That means there is something mechanical agent which is causing the sensation of pain, or it may be thermal. That means temperature, which is giving us a sensation of pain. It may be chemical. So there may be different type of chemicals produced by nerve endings which are causing the sensation of pain. For example, one common example you can just note down, and there are many, but you can just note down a few. For example, acetylcholine. It is secreted from the nerve ending only. It is a very common neurotransmitter which gives us the sensation of pain. Apart from acetylcholine, there is histamine, prostaglandin, and different type of enzymes, proteolytic enzymes, which can give us a sensation of pain. So these are the different agents which work for pain production or pain sensation in the body. Okay. Now, I showed you the picture which is responsible, which is the pathway for pain. Another picture I'll show you that is also very simple, and you can keep it for future reference. This is the same picture as I showed you right now, how this pain is traveling to the brain. It is a simplified version that this was an area which was hurting. Okay, knee was the area which was painful. Now the sensation through the efferent nerve, it is going to this is spinal cord. It is going to the spinal cord. From spinal cord through spinothalamic tract, it is going to the thalamus. From thalamus, it is going to the somatosensory cortex. Somatosensory cortex is the cerebral cortex, part of cerebral cortex which is sensing the pain. Okay, And from there again, it comes back to the area and gives us the sensation of pain. Okay, so this is a very interesting picture which you can keep for future reference. There's one more picture I will show you that is also very nice picture. These pictures you will understand better if you sit quietly with the pictures and read what is written there. So here also you can see there was this area which was getting hurt. So from here, the pain receptors took the sensation to the spinal cord. Okay, so there was this was the pathway where it came to, and from spinal cord, now it went up to the brain, to the thalamus, then to the cerebral cortex. And again, you can see there's another blue line. Okay, so one is efferent, one is efferent. So it is giving us a sensation of pain. So this is very important. Now, there's another point which we should understand. When we talk about pain, we never analyze that this pain can be of different types. Okay, so there are actually two types of pain. Have you ever thought about it, that this pain can be of different types? What we have understood till date practically is there are two types of pain. One is physical pain and one is emotional or mental pain, right? But if we talk about human body, then this pain also has speed. Have you ever thought about it? There's one pain. If there is any cut here, you'll find a type of pain. Okay. And this headache, there's another type of pain. Which one do you think? This is A and this is B. Which one do you think is a fast pain? A or B? Definitely A, because it is sharp. So if there is any cut, any burn, any electrical stimuli, then the type of pain which we feel is fast pain. Another type of pain is slow pain or dull pain. That type of pain is actually diffused pain. See, this is so interesting. If you analyze the body, our body has so much categorization. For example, headache is a dull pain. Arm is paining, it's a dull pain. Neck pain or cervical spondylitis, it is a fast, slow or dull pain. Knee pain is a dull pain or slow pain, isn't it? So these are different type of categorization. But why this difference is there? Why at times you are finding the pain to be very fast, very sharp, and at times you are finding the pain to be slow? Which book? This is the same book which we are talking about. We are not going out of syllabus. We are totally with the book Parikshan only by Professor G.C. Agarwal ji. But you just listen to what I'm saying. Afterwards, you go through the book. Understand the subject first. If you understand the subject, then you can understand whatever is written in the chapter and in the book. Okay. So why some pain are fast pain and other type of pains are slow pain? What is creating this difference? This difference is because of the type of wire which is carrying the stimulus. Wiring, there is difference in wiring. The type of wire which you will use for internet, you will not use for electrical supply. Right or wrong? Correct? So there are different type of wires for different type of carrying of impulse. So the type of wire which is used to carry the impulse of fast pain is a long wire. It is taking the impulse directly to the brain with a high speed. How much speed? Maybe 0.1 second. In 0.1 second, it is taking the impulse to the brain. But other type of wire is a short wire. It will take the pain slowly to the area where it has to reach. And since it is traveling in a slow speed, maybe more than 1 second, so it will give us a sensation of pain in a very slow way. It would be a dull feeling. Okay. Another reason for this dull sensation or less sensation or diffuse sensation of pain is if an area is supplied highly with pain receptors, what were the pain receptors? Nociceptors were the pain receptors. So if the area is highly supplied by the pain receptors, you will feel the pain accurately and at a particular location in a very good way. But if the pain receptors are less in number, if the pain receptors are diffused, if the pain receptors are not accumulated in an area properly, then what you will feel is it is a diffused pain. For example, take an example. If there is any cut on the skin, or if an area of the skin is burnt, or there is an injury on the finger, you can make out with closed eyes also that which area is hurting the most. So you can, if this area is cut on the index finger, topmost phalange, if there's a cut here, you can make out with closed eyes also, okay, this area is hurting, my tip of the finger is hurting. But if you have pain in heart, for example, in a particular region, will you be able to make out which chamber is hurting? Which part of heart is aching? If there is pain in the abdomen in a particular area, in a particular organ, for example, one particular lobe of liver is hurting, there is a boil or cyst or some type of abscess is there in particular area, particular lobe of the liver, will you be able to make out, okay, my fourth lobe is aching in the liver? Can you make out that? No, you cannot make out. Why? Because the pain sensation receptors are diffused in that area. So we don't make out, we cannot make out which area is hurting. Okay, so this is another point which we should understand and think, that pain receptors are very important to understand which area is hurting. Okay, now this pain management, okay, it also varies from person to person. I can see a few faces, for example, Neeta ji or Shamla ji or Archana ji or Sushma ji. So if I ask them, what is the amount of pain you will feel if I pinch you? You can also make out with the expression of the patient. If the patient comes to you, same pressure gives different type of reaction with different patients. Yes or no? Some patients start shouting, oh, you're hurting. This point is hurting me a lot. Some patients, they take the feeling of sensation that they can bear, they can hold that sensation of pain, and they say, okay, I can bear this pain. Why this pain varies from person to person? This is so interesting. At times you can bear the pain, and this also varies from time to time in the same person. See, these are two different things. At times you can take the pain, at times you cannot take the pain. Talk about the emotional pain, for example. If someone is disturbing you, at time you will have the patience to say, okay, this person is disturbing me and I can take this disturbance. You can hold that irritation or pain which is created emotionally or mental level. On the other hand, at times you will burst into tears and you will say, don't irritate me or don't give me this much of pain. Same person, same intensity of the irritation or the external stimuli which is coming to you, but your reaction will vary. Are you understanding what I'm saying? Why this happens? This happens because of the nervous system. And this is also very interesting. We are going little out of track, but related to acupressure only. All this is because of the emotional condition of a person. Okay, and especially in case of females, this is very important because the hormones are the controller of the emotional condition of the patient. You will feel and you will understand and you will diagnose in females. Specifically, if the females are coming to you with mental issues or emotional issues, the hormones are responsible for that pain factor which is giving them the trouble. Maybe the ailment is not so chronic, the ailment is not so high in level, but the emotions which are getting disturbed are because of the hormones. Is this clear? Are you understanding? So now what will you treat? You will treat the ailment, you will treat the pain, or you will treat the emotional condition of the patient. Definitely you will treat the emotional condition of the patient. That means you will treat the hormones of the body. A female who is coming to you, she does not have a lot of symptoms of knee pain, but she is complaining of knee pain continuously. And when you talk about knee pain, she starts crying, for example. Then what will you treat? Will you treat still the knee pain, or you will treat the trauma or the emotions or the hormonal disturbances which she is going through? SP4P6 EOV, you will choose. You can choose, because there's something happening with the person which is disturbing her, and that disturbance is causing the problem in the weakest part of the body, and for her the weakest part of the body is the knee. Did you get my point? Okay, so that is also pain. That is also diagnosis. So find out where the pain is, whether the pain is at the physical level or the pain is at the mental or emotional level. And most of the times the pain is at the emotional level only. Okay. Now, what we were talking about is also very interesting, that how a person manages this pain internally, how you can bear that pain, how the body takes control of this pain through pain management. I'll show you one picture. This is also very important, but before that, write down the word related to that, and that is analgesia or analgesic system of the body. Analgesia is related to pain. What is the pain system of the body? That is managing pain in the body. That is allowing your body to bear the pain, or at times not allowing your body to bear the pain. Who is responsible for that? So the part of the body which is responsible for this management of pain is central nervous system. Okay, and in central nervous system also, specifically, different parts of the brain are responsible for helping you bear this feeling of pain. So there are especially three parts of brain responsible for analgesic system. What are the three parts? The first part is, write down the spelling and try to learn the spelling. It's a new word, but we will learn the spelling. From every chapter, we will learn 1-2 new words. Peri, equi, A-Q-U-E, peri, equi, ductal, gray. This is the name of the area of the brain which is managing the pain, analgesic system of the body. Okay, peri, equi, ductal, gray, and periventricular nuclei. Periventricular nuclei. Where are these two parts of brain present? It is present in the midbrain. Midbrain is also called mesencephalon. Mesen means middle, cephalon means brain. Okay, so midbrain. Second part of the brain, which is also playing important role in this analgesic system, is Raphe, R-A-P-H-E, Raphe Magnus nucleus. Raphe Magnus nucleus. Where is this part of brain present? It is present in pons and medulla. Okay, and third part of this analgesic system, which is again a very important part, and it is pain inhibitory complex. Where is this pain inhibitory? Pain inhibitory. See the word itself, pain inhibitory. It will inhibit the sensation of pain. So where is this pain inhibitory complex present? It is present in dorsal horn of spinal cord. So you have three parts of central nervous system. One is the midbrain, another one is pons and medulla, and third is the spinal cord. And you have the names of different areas of these parts of central nervous system, which are important to control the sensation of pain. How much pain you can bear, who will be responsible for that? If your nervous system, central nervous system is strong, you can bear more pain. Okay, now see this picture. Again, keep this picture for future reference. It is a very, very important picture that has all the labelings, all the names which we discussed right now. For example, we spoke about periaqueductal gray, right? This was the first name. Periventricular nuclei. This is another name. Where are these present? These are present in the midbrain. Midbrain is also called mesencephalon. Correct? So these area, this particular area is the midbrain area. Then we spoke about two more names. One is raphe magnus nucleus. Where is this present? It is present in pons and medulla. So see, this is pons and this is medulla. And third one is the different type of hormones. For example, the pain releasing complexes, enkephalin neurons, serotogenic neuron, all these are present, and it is forming a complex presynaptic pain inhibition complex. Where is it forming this type of complex? In the spine. Which area of the spine? The dorsal. This is the dorsal horn. So this part is the dorsal horn. So if I simplify the thing for you, then what we should understand is pain management is by, how will you remember? What will we remember? We'll remember that pain management is by the central nervous system. That is making the analgesic system of the body. Okay, point number one. Point number two to remember is there are some parts in the midbrain. There are some parts in the pons and medulla. And there is some complex, there's some integrity, or there is some constitution in the spinal cord. So the spinal cord, midbrain, pons, and medulla all together. So that means the hindbrain, the back of the brain, and the spine is responsible for management of pain in the body. How much pain you can bear, how much pain you can hold. For that, the back side of the brain is very important. And that is why in 99% of the cases, backhead and treatment on spine gives us very good result, because most of the patients are coming with the problem of pain only. So if you treat backhead means whether you treat it through direct area of pons, medulla, spine, or for example, we treat it on the backside of the thumb. So this is what backhead, pons, medulla, all the vital activities are controlled by this particular area. So a Matthews strip on this area, in most of the cases, we prefer this Matthews strip here, because this is the area which is playing vital role to control most of the activities. And it will also reduce, it will also give the patient the ability to hold the pain or bear the pain, or have that ability that the the person can take, not only of the treatment, but also of the ailment. Okay. So for that, it is very important that you treat all these parts. So this is another learning today, that treat pons, medulla, spine for pain. Okay, fine. Now, there is a very beautiful topic in this book itself, and it talks about referred pain. This referred pain is also very important to understand what this referred pain is about. Referred pain. What is referred pain? What is the meaning of referred pain? If you are getting hurt, if you got, I'm giving you a very silly example, but just understand what referred pain is. If you're getting hurt in certain part of the body, for example, your finger got hurt. Okay. Or if someone said, okay, take this example only. If you got hurt in the finger and you're crying and your head starts paining. You got hurt here, but the pain is here now. So if the area of pain is different from the area which is getting hurt, that pain is called referred pain. Did you get my point? If the area of pain is different from the area which got hurt or which got affected actually, then we call it referred pain. Most common example is heart pain. If someone is getting heart attack, for example, where does this pain go to? What is the area that gets affected? If someone is having this heart attack pain or pain related to heart, the person says that my pain goes to left arm, especially to the medial side, to the small finger side, right? This is the area. Though it matches with the meridian itself, with the heart meridian, but actually the pain goes to this area, left arm, correct? So this type of pain, the pain was not here actually. This is not the area which got affected. There's no relation between this area which is getting hurt and heart. Heart is the organ which is the area of concern right now. But where is this pain? No, we're not talking about shifting pain. Shifting pain is a type of pain which at times you will feel on the head region, at times it is on the neck region, at times it is coming to the leg. So that type of pain is called shifting pain. We are talking about the pain which you will feel in a different area always when another organ of yours is affected. For example, if heart is affected, always the pain goes to the left arm, this side. Okay. So there are different areas which are marked and which are fixed. You cannot change it. You cannot say that it is shifting every time with the type of pain you are having. So that type of pain is called referred pain. Why does this referred pain happen? Why this referred pain is at a different place from the area of origin? Wherever the origin of the problem is there, this pain is different from that area. Why is it different from that area? There must be some connection between the two. If someone is slapping your child, the mother starts crying. Why mother starts crying? So it's again a very silly example I'm giving. Child has got hurt, mother is crying. Why? There must be some connection between the two. If there is no connection, no emotion related to that. Correct? Both are interrelated, both are connected. So if an organ is in pain and the pain is radiating to another area, that means both the areas must be connected somewhere. This is very important, huh? Very important to understand, because this will also give you the answer why you treat a certain area and another area gets healed up automatically. Most of the time this happens. A patient comes with a certain problem. Mrinalini ji, are you understanding what I am saying? Patient comes with a particular problem. But when we treat the patient with that problem, the patient, maybe after 3-4 weeks, the patient says that I never paid attention to this part of mine which was hurting, but now that pain is also gone. Many a times we get this feedback. I came with the particular problem, but now my other problem is also solved. Why is this happening? Must be there's some connection between the two organs internally, and this is a fact. This is what we are observing day and night in acupressure. One finger of yours, take one finger of yours, left hand small finger of yours. Left hand small finger, if we talk about Ayurvedic acupressure, you have heart and small intestine, right? The joint of heart and small intestine, correct? This finger also has, if you talk about Dr. Wall, then you have small intestine here, heart, meridian, somehow it got interrelated, but let us take right hand small finger. Right hand small finger has lung and large intestine, correct? It also has heart and small intestine, lung and large intestine, heart and small intestine, all are here. If you talk about correspondence system, then this is your right hand small finger is your left arm. If you talk about insect correspondence, then the upper phalanx belongs to your face, middle belongs to your chest, lower belongs to your abdomen. So if you treat right hand small finger, if you just roll ring on the right hand small finger, you are treating not only lung, large intestine, you're also treating heart, you're treating small intestine, you're treating face, you're treating chest, you're treating the abdominal region, that means the whole body. Then you will say, at times this question is a very common question asked by different students, that when we are treating a certain area, another area is also falling on the same joint or same area, then how do we understand what are we treating actually? How does our body know that whether this treatment has to go to heart, or this treatment has to go to small intestine, or this treatment has to work on lung or large intestine? I am saying every part. This was a question by me as well. I always used to ask this question when I was learning, because I always used to feel that when I'm treating, for example, the uppermost phalanx, there are so many points of Biol meridian here. And at the same time, you're saying that this part has Dr. Walka some points here. And in the same time, it has other Ayurvedic acupressure points also. So how does my body know what I'm going to heal? I'm going to heal according to Ayurvedic acupressure, I have to heal according to Dr. Wall, or I have to heal according to correspondence system. Now I understand that it heals all together, because your body inside, there is no segregation, there is no chamber. For our convenience, we talk about respiratory system as one, the excretory system as one, the hormonal system as one. All these are individual entities for us to understand, to make it simple, but inside everything is interrelated. So there is nerve connection between different organs and skin area specifically, and for that reason the referred pain appears. So if I talk about heart and this area, then there must be some neuro connection, some same area traversed by nerve for heart and in this area, which is giving pain in this area. Okay, I'll show you one picture. It is a very, very important picture. You can keep it with yourself for future reference, and this will solve a lot of your problems. And this picture is for referred pain. Okay, so which area is giving you trouble and what this trouble may signify? For example, take one example, the topmost front of neck and back of neck area or the shoulder area is for lung and diaphragm. Now you will say how diaphragm pain is falling into this zone, because this is referred pain. Okay, similarly, see the heart region. This whole region is heart ka region. So you go through each and every organ of yours and see where this pain is coming to. For example, kidney pain, the whole of the lower part, starting from the lumbar area, front and back, it is giving us the area of kidney. also see ureter. Ureter pain comes in the genitals and in the groin, downward medial side of the body. Okay, so these are some very important areas which are giving us another important one is liver and gallbladder. So liver and gallbladder in front, if it is the liver area in front, on the back side, lower side of the scapula gives the hint of liver and gallbladder pain. So this is a very important picture. And patient will come and tell you that this is the area which is painful. Now see whether it is falling into referred pain or not. If it is falling into referred pain, it will give you a hint, okay, this may be the problem. If a patient is coming to you with gallbladder stone, or if a patient is coming to you with kidney stone, how will you understand? How is, see, acupressure is not only a modality of treatment, it is also a very important and good tool for diagnosis. Remember this in your head. So you are not only treating a patient, you are also diagnosing a patient. Like palmistry or astrology is a science which gives a hint what has happened and what may happen with the person. Similarly, you are no less than a scientist because you know what is happening with the body, what may have happened in the past, and what may be the consequences in future. Because you know how to read a person's body. Okay, so this is a very, very important, strong tool with you. So referred pain is very important. Keep this chart with you. This is a very important chart. Another important tool with you is many a times patient will come to you with abdominal problems. So abdominal area, yes, it is very nice because I strongly feel that we have got some important tool with us which we are unaware of. It is actually making us very strong because you know how to understand a person. Okay, so I always say that when you have this tool of acupressure with you, it is like some invisible power which is seeped within you. It is there within you because you can understand, you can read a person, you can read the energy of a person. Okay, another important tool with you is abdominal diagnosis. What is that abdominal diagnosis? Like what we did right now is about referred pain. Similarly, you have a tool for abdomen to diagnose. So for that particular region, if a patient comes to you with abdominal pain or some abdominal ailment, see which quadrant of it is affected. Now, what is the meaning of quadrant? If we divide the whole abdomen into 9 areas, okay, so if this is abdomen, this is diaphragm, so these are the ribs. Am I audible? Am I audible? Okay. So if these are the ribs, so just below the rib, if you draw a horizontal line, and this is the inguinal area. So this line is actually the inguinal area. If you draw another line here, and two vertical, and there's a line in the center. I'll show you the picture. Two vertical lines through the inguinal area. No, not like this. I'll show you the picture only. This is a very important picture. So what we are doing is we are drawing, this is the diaphragm area. Okay, so there's a line which is called the subcostal C-O-S-T-A-L, subcostal plane. What is a subcostal plane? This line is called subcostal plane, subcostal line. Why this is called subcostal line? I'll give you the reason for that. This is also a very important picture. These are the ribs. This is one rib, another rib, one more. All these are ribs. Okay. And how these ribs are attached to the center of the body, to the central bone, which is called the sternum, through cartilage. So these are the cartilages. These are blue ones are cartilage. And the last few bones of the rib have a lining which is called the costal margin. Understand this. Okay. So this red line shown here is nothing but the costal margin. So at the end of this costal margin, if we draw a line after the 10th costal margin, 10th costal rib, if you draw a line, so where is that? See this one. So we are drawing a line. At the end of the 10th costal margin. And this line is actually at the level of L3, lumbar 3, this line. Okay. And another line, this is one. And second line, which is again a horizontal line, and this passes through iliac tubercle. What is iliac tubercle? Iliac tubercle means the iliac, the topmost point of the iliac bone, the hip bone, topmost point. So this is the topmost point. So another line is going through the topmost point of the iliac bone. And these two lines and two vertical lines. Where are the vertical lines? These vertical lines are actually the center point of the inguinal ligament. So this is the center point of the inguinal ligament. So if we draw two imaginary vertical lines and two horizontal lines, or in rough, with rough idea, if we divide the whole of the abdomen into 9 equal regions, this so we can do. Just imagine the abdomen to be divided into 9 equal regions with umbilicus or the navel as a center one. Can we do that? So if we get 9 regions, then each region has a name. You start with this one as 1, right region as 1. So right hypochondriac, then epigastric, then left hypochondriac, then right lumbar region, umbilical region, left lumbar region, right iliac region, hypogastric region, and left iliac region. It is very easy to remember if you just remember that this is epigastric, this is hypogastric. This you can remember. Topmost, just below the sternum, is epigastric. And the lower one is hypogastric. The one which is above gastric, that means above stomach, is epi, and below one is hypo. Center one is umbilicus. So these three, so you can easily remember. Apart from that, it is right hypochondriac, this is left hypochondriac. This is right lumbar, this is left lumbar. This is right iliac, this is left iliac. Why iliac? Because iliac is a bone. And whichever organ is falling into that area, that organ will tell you which, whichever area is paining will guide you in understanding which organ is falling into that area and have the ailment. Is this okay? For example, if there is pain in this area, right lumbar region, this is also important to understand that when someone is complaining about a particular area of the abdomen which is having the pain, how will you write in your diary or in your paper? How will you write? You will write on right side of the body, middle part, beside navel, there is pain. Or you just write area number 4. Isn't it? It is more systematic. Correct? So, and when you think about area number 4, you also think about which organ is falling into that area. So you will have an idea what may be happening in the body. Whether there is problem in the ascending colon or there is problem in the descending colon. So, for example, see this picture. This is ascending colon. Correct? So if someone is complaining of problem here, definitely you will think about colon, ascending colon. You will also think about a part of the liver which is falling into this quadrant. You will also think about some small intestine issues. So now you will have an idea, you will have that thought in your mind that which area may be affected if this particular quadrant or this particular zone of abdomen is having the trouble. So this is also a very important tool, not only of diagnosis, but of treatment also. Okay. So this was your abdominal diagnosis. Similarly, there is a chart given at the end of the chapter. You go through that chart. That chart is marvelous chart for diagnosis purpose, where it talks about different type of ailments. For example, just a moment, let me show you the chart. So this is a chart which I'm talking about, inflammation of GIT parts. Okay, so this is actually this chart particularly talks about different ailments. For example, peptic ulcer, perforation, stomach cancer, small intestinal obstruction, large intestinal obstruction, appendicitis, liver parenchymal disease, gallbladder stone, pancreatitis, kidney glomerular nephritis, ureter calculus, peritonitis. See, some of the ailments are chronic ailments, big ailments, but some ailments are there with which patients will frequently visit you. For example, a patient is visiting you with gallbladder stone, or a patient is coming to you with liver acute parenchymal disease. So how will you, or maybe with stomach ulcer, which is called peptic ulcer, how will you understand where the pain would be? So this chart says, for example, peptic ulcer, which area would be painful? What would be the symptom? What would be the physical sign? And how this pain starts, whether it is acute, sudden, all the time, random, chronic. So just go through this chart. This chart will give you a lot of understanding of the types of ailments and what type of pains and what type of areas and how that pain would be if the person is suffering from these ailments. Just read it. You will enjoy reading it. Okay. So this is all about pain. It's a very beautiful topic, which you will always remember whenever you are seeing a patient. So with this, we'll end the session today. Thank you so much for joining and listening to me.